Hello, this is Louise. I'm doing a video discussion with Dr. Ramona Wong. She's a retired nephrologist in Honolulu. A nephrologist is a doctor who specializes in kidney disease. Dr. Wong also runs a class of extremely informative workshops for people with chronic kidney disease, which of course are on hiatus because of the pandemic. So we thought we'd try a Zoom discussion to get some information out to people. So hello, Dr. Wong. Thank you so much for doing this with us.
Thank you for having me.
Okay. So we've got a list of questions that we've agreed on, so hopefully this will go smoothly. So the first question is, what are the causes of chronic kidney disease?
There are many causes, but the most common two, which account for more than 80% of all kidney failure, are diabetes, largely type 2, but type 1 also, and hypertension, high blood pressure. But there are many other causes, and if you have any cardiovascular disease, heart, brain, limb, it also can implicate your kidney function and cause chronic kidney disease. Too low blood pressure for too long a period of time can cause chronic kidney damage. And then there's a host of other systemic diseases, or even kind of unique to the kidney diseases that can cause kidney damage.
So you mentioned diabetes as a major cause of chronic kidney disease. What causes diabetes?
Well, there are two types of diabetes, and type 1 is autoimmune, largely autoimmune causes. Sometimes a bad virus can attack the pancreas also and kill the cells that make insulin. So there are, a couple reasons why people have type 1 diabetes, but the large majority who have diabetes have type 2. And type 2 diabetes has to do with, there's multiple factors, but the bottom line is that there's insulin resistance. So you have insulin production, but you're resistant. You make sort of blockers to your insulin, so it can't work. And that's why blood sugars go up. High blood sugars over a prolonged period of time cause scarring or make pukas and damage to the filter of your kidney. And then after they're damaged, they scar and you lose your kidney filters faster than natural aging.
And how big a factor is diet in staying as healthy as you can with diabetes?
It's one of the major factors, but it's not the only factor, but it's a very important choice that we make every single day. So it's good to understand how your body processes what you put into it. And so diet, the food and drink that you put into your mouth, but also there's a lot of other things that you put into your body, your thoughts, so stress and those kinds of things can also impact diabetes as well. But diet is very important.
And is it possible to control diabetes entirely with diet and not need to use drugs?
I think depending on when you try to do that, but yes, there are ways to get your diabetes under control so that, I guess it's not necessarily for every person, but for especially earlier on, you can reverse pre-diabetes. You can probably get diabetes under very good control with your lifestyle choices.
So you've mentioned hypertension. Is there a relationship between body weight and hypertension?
Yes. So higher body weight tends to increase your chances of getting high blood pressure, but especially where you put your excess weight. So the excess weight accumulating around your tummy organs, if you put fat in and around the tummy organs in the abdomen, they call that visceral fat. Well, then that's what tends to be associated with high blood pressure, diabetes, chronic diseases, even cancers. So you don't want to put your fat there.
If only we had that choice.
tell, though, if you're starting to put on weight, then your genetics may have something to do with where you put your fat. So you just might have to look at your family members, look at your family tree, and see what kinds of things, how they manage and how their bodies are, and that you might be at higher chance of doing the same kind of thing.
And what's the relationship between body weight and diabetes?
Again, the visceral fat can be um, is one big factor that you can for type 2 diabetes, where it makes insulin blockers. And so if you accumulate visceral fat, then it will make blockers to your insulin, and then your sugars will not be adequately controlled because your insulin cannot do the work it's supposed to do. It's supposed to take the sugar out of the blood or control the blood sugar. And if it cannot do its work, then your sugars will go up. You have type 2 diabetes.
Okay. And any relationship between weight and cholesterol?
I think the lipids are a little more complicated. Well, everything's more complicated than what I'm talking about because there's only, a little bit of what we think we know. But if you have increased visceral fat, again, I think there's a possibility that you can have abnormal cholesterols. But cholesterols, there's other factors that come into play, not just weight.
So then, do all of these things, body weight, hypertension, diabetes, cholesterol, contribute individually or collectively to kidney disease?
Yes. All of the above. But again, it depends on your genetics as well. So some people don't get kidney disease, even though they have diabetes and high blood pressure. So it's fascinating. It's not so simple. But certainly if you wanted to try not to get chronic organ kidney disease or other organ damage, then if you wanted to kind of play it safe, then you would take care of all these things, or you would try to make choices so that you don't get into trouble with imbalance.
Okay, so someone's going along in life. How do they first find out they have chronic kidney disease typically?
It's usually a surprise because the kidneys are very silent about this. It's they're very quiet. They work hard, but they're very quiet organs. And so they don't hurt when they're first getting damaged. You don't sense pain usually at any point in the majority of people that have chronic kidney disease. So kidneys don't usually hurt. So usually it's a lab test. And if you have a risk factor for kidney disease, then people are screened typically annually by their doctors with a blood test and a urine albumin to creatinine ratio, which is a check for urine protein in the urine. And so it's usually lab tests that will show up abnormalities.
So given that, it sounds like there really aren't any symptoms people need to pay attention for.
Early on, there are no symptoms for chronic, slow, gradual onset of kidney disease. There's no symptoms until very late. So you don't want to wait for symptoms. You want to understand what the risk factors are. You want to understand how to live healthy and take care of this body, which is a huge gift. And then if you have any of the risk factors, then that would be a reason to screen for the early signs of kidney disease with your doctor through labs.
And I think one of the things I've learned is how important it is to monitor your blood pressure so that if your blood pressure goes up, you talk to your doctor.
Right. It's good to get checked once in a while. I mean, if you're perfectly normal, then just have it checked once in a while. Even if it's just annually, if you're young, adult, and healthy, you don't have to check it or worry about this. It's just, periodically just check if you just want to make sure that you're maintaining health.
So are there prompts where a person should ask for a specific test for kidney disease?
I think if you have any of the risk factors, so if you have a family history of kidney disease, or you have diabetes, or you have pre-diabetes, well, you won't have kidney disease when you have pre-diabetes. You won't have diabetic kidney disease when you're pre-diabetic. But if you have diabetes, or you have high blood pressure, or family history of kidney disease, or you've had a lot of stones in the past, or trauma to your kidney in the past, where acute kidney injury for some reason, or you have some kind of systemic disease like lupus. There's autoimmune diseases, can also affect the kidneys. So if you have any of the risk factors, um, then it's reasonable to ask annually to get your kidneys checked and screened to make sure they're not being affected. If you don't have any risk factors for kidney disease, then it doesn't make sense to get screened for it annually. It's probably overkill, so to speak. But for anybody with risk factors, yes, annually.
Okay, cool. Um, and when should a person be referred to a nephrologist, someone who specializes in kidney disease?
If they have loss of kidney function faster than natural aging, and it's progressive, it's getting worse, or they have any protein in their urine, any albumin in the urine, any protein, which is a type of protein, uh, then it's reasonable to be seen by a kidney specialist. Sometimes, though, the PCP, the primary care physician, and the patient feel comfortable with the PCP managing this. But I always say, well, if you have kidney disease, or you have, which is inclusive of protein in the urine, then if the patient or the doctor PCP wants a nephrologist to weigh in on it, then I think it's appropriate. If neither of them want a nephrologist to weigh in on it, then they may be very fine just taking care of it themselves. But certainly, once you get to stage 3, 4, which is where you've lost 40 to 50, 60% of your function, certainly by then you should see a kidney doctor. But to me, it's always good earlier to understand, well, why is this happening? Is there anything we can do to slow it down? Can we reverse it? Those kinds of questions are important early on. What's the cause? Can we reverse it? And so the earliest possible to me is the time to ask those questions.
Yeah, I have to say, in my experience, I completely agree. Getting knowledgeable input early on always helps.
And if you're nephrologist, if you go to see a kidney doctor and they say, oh, you guys are doing everything possible, there's nothing more I have to add, fine, that's great. It's just reaffirms that no stone is unturned. But what I don't like to hear is when people say, oh, I'm stage 5 and I'm just meeting the kidney doctor for the first time. And that's really unfortunate. It could have been much earlier, hopefully.
Yeah, and what I've learned, like diabetes, diet is critically important to kidney function and possibly slowing progression of loss. So the earlier the better, like most things in life.
Yes.
So for patients who have gotten on or approaching stage 5, where they're approaching complete renal failure, can you describe the types of dialysis that are available to them and what's important to know about dialysis?
Well, we can talk for hours on this, but and we do. Yeah. There's basically 2 types of dialysis. And so your options, if you are approaching kidney failure, are life-prolonging therapy with dialysis or kidney transplantation, or natural life with supportive and medication and diet and comfort support. So those are kind of the 3 general option classes or categories. In dialysis, if you're to choose life prolonging therapy with dialysis, then there's 2 basic types of dialysis. There's hemo blood dialysis, where we take blood out of your body, filter it because the kidneys are not able to filter it, and return filtered blood back to you. So there's hemodialysis, and then there's peritoneal dialysis, where we actually put a solution in your tummy and it pulls water from your blood vessels, and with it the wastes and things you don't want in your bloodstream. So it basically filters your blood in your abdominal cavity or peritoneal cavity, and then we drain out that fluid. So that's peritoneal dialysis, and that's a home therapy. Hemodialysis is usually done in clinic, but it can be done at home as well if you're willing to train to be done at home. And at this time of COVID, you know, more people are wanting not to go into a center or be with a whole bunch of other people. And so home dialysis modalities, I think COVID has kind of underscored the options of doing dialysis at home if you prefer. So either one could be done at home with training, and hemodialysis is provided in the center.
So, in deciding, assuming someone is seeing a nephrologist and understanding the path they're on, that gives them time to make decisions about dialysis. What kinds of factors would typically lead someone to choose peritoneal dialysis or hemodialysis?
Peritoneal dialysis, I think once you understand what it takes to do these different types of dialysis, then you can make an informed, you can have a preference and you can make an informed choice as to what you're willing to do. So I think the first step is to come understand what they're all about in more detail than what we're talking about today. But for those who choose peritoneal, they usually prefer to do home treatments. It's a home dialysis modality. There's no needles involved and there's no blood out of body. So if you're squeamish about needles and blood, then that's another motivating factor for peritoneal dialysis. It's also gentler. It's not as efficient. So you have to do peritoneal dialysis every day. And we have fluid in your tummy area, trying to pull waste from your bloodstream all day long. So it's kind of a continuous, it's not as efficient. So we need to do it kind of continuously. It's working in your body. You're not having to deal with it all day long, but it's working all day long. And so I think people that want to do their own, have a little bit more control over their lives, and do their own treatments, life-prolonging treatments at home, as well as not deal with the blood and needles. And if they want a more liberal diet, because if we're doing it every day, then we're not as restrictive on what you can eat and drink. Hemodialysis is usually done only 3 times a week, so it's a more restrictive diet because whatever you're eating and drinking is building up into your next dialysis session. So peritoneal dialysis is a little more liberal with your diet and liquid intake for sure. You know, we need you to drink liquid actually. And it's also, if you are at all interested in doing that modality, we'd like you to try that one first. It helps if you have a little kidney function of your own to help with the efficiency of cleaning your blood. So starting with peritoneal dialysis is better than starting with hemo and then going to PD. I mean, it's possible. They're all options. But if you start when you have residual kidney function, PD is a much easier transition to make.
So I've heard of a program among, I guess, dialysis centers called Fistula First, which leads to the question of when do patients typically get a fistula and when would you recommend they get a fistula? This is for hemodialysis.
Correct. So fistula is the surgery that's needed to prepare for hemodialysis. And some people, even if they want peritoneal dialysis, they get a fistula as well for backup in case the peritoneal dialysis doesn't work for them or something happens. But we suggest having that fistula surgery, which is a connection between your artery and your own vein. And it's outpatient surgery. Generally, we suggest that you consider that surgery when your kidney function has reduced to about 20% of normal. So once you've lost 80% of your kidney function, that would be a good time to work on that fistula meet the surgeon, get it scheduled, and get it working because it takes months, sometimes years for it to mature, to develop to the point where it's usable. So we want it usable at the time that you need hemodialysis. And if we don't get it in and it's not usable in time, then we have to use catheters or plastic tubes in your bloodstream, which have have their own risks of high risks of infection and complications. So usually around 20% kidney function is when we suggest having a fistula created.
So transplants are also an option for people in kidney failure. Um, can you tell us some specifics relative to insurance coverage, the anti-rejection drugs people would have to take, and whether or not transplant is considered a cure for kidney function loss?
Kidney transplantation is major surgery. So it's not available for anyone who wants it. You have to be medically healthy enough to survive the surgery, to be cleared, to be a good enough risk to have the surgery done to you. Because we're also it's not just you undergoing some risk. We're risking the viability or the longevity of this kidney, this organ that is precious, well, and being donated. So you need medical clearance and adequate health to receive a kidney transplant into your body. The insurance coverage will vary. Most people if you've earned Medicare benefits, most people will have Medicare coverage for the bulk of their transplant costs. And so between their Medicare coverage and private insurance, so usually patients have dual coverage, then there's very little out-of-pocket cost for the kidney transplant. However, not everybody has Medicare benefits, and not everybody qualifies for continued Medicare benefits. Even if you have a kidney transplant and it's covered, you have dual coverage, and the cost of the surgery and the medications are largely covered with very little out-of-pocket costs. If you're younger than 65 and you have a working kidney transplant for 3 years, then you lose your Medicare benefit because you receive Medicare coverage because of kidney failure. After 3 years of a working kidney transplant, you technically don't have, you're not,
Right.
no longer are in kidney failure state. So you go back to having just private insurance, and you may have then a 20% copay. These medications are pretty expensive, and I'm sure they're rising as new drugs
Of
come about.
course.
Yeah. So it's sometimes, gosh, I hate to say the ballpark because it depends on which drugs, but sometimes, $30,000 a year kind of is not uncommon. And so you might have to bear 20% of that cost out of pocket if you only have single coverage. So what's really important is not to get hung up on that, but it's an important question to ask. All kidney transplant programs have financial advisors and counselors, so they look very carefully at your insurance coverage, and they should be able to tell you specifically what it might be out of pocket now, for the surgery as well as down the road. Okay, so kidney transplantation, if it's working well, will provide adequate kidney function for life. And so you don't need a life-prolonging therapy like dialysis if you have a working kidney transplant. But kidney transplants are not guaranteed to last for the rest of for your natural life expectancy. The average kidney transplant lasts between 8 to 15 years, depending on whether you have a deceased donor kidney transplant, so somebody who is passing away and their organs are donated. That's more of the 8 to 10-year average lifespan of that kind of kidney, versus a living donor kidney transplant so somebody who's live and donating one of their kidneys to you, those kidneys tend to last on average around 15 years. So it's not forever, but that said, there are some kidney transplants that last more than 40 years, whether it's deceased or living donated, but others who don't even last a year. So again, there's kind of an average, but the whole spectrum. So it's not considered a cure, but it's most like natural to have if everything goes well. But there are risks to kidney transplant as well.
Like everything in life. Yeah. Okay. So Dr. Wong, can you tell us what the different stages of kidney disease are, what they mean?
the stages of kidney disease are based on estimated GFR, or estimated residual kidney function. And so the stages are 1 through 5, CKD stage 1 through 5. Stage 1 is where you have greater than 90% kidney function remaining, but some evidence of damage to your kidneys, in maybe protein in your urine or whatever. But so stage 1, you have greater than 90% remaining kidney function, filtering ability. Stage 2, 60 to 90%. Stage 3, 30 to 60%. And they sometimes break that up into A and B, 3A and 3B. And stage 4, 15 to 30% remaining kidney function. Stage 5 is less than 15% remaining kidney function. So when people talk about their stage of kidney disease, and that's what they're referring to. Their doctors told them what stage they're at. Now, we all lose a little bit of kidney function naturally from natural aging, healthy aging. And so there is a way to calculate, and we can go into that another time maybe. There's a way to calculate where you should be for your age if you're healthy and your kidneys are aging naturally. But that's a discussion you can have with your doctor. If you're told that you're at a certain stage, then you can say, well, is that appropriate for my age? You should ask that question.
Okay.
I've also heard that there's a greater incidence of kidney disease in Hawaii, and specifically among Native Hawaiians and Pacific Islanders. What can you say about that?
According to the United States Renal Data Service annual report, so the United States, the USRDS is what it's called. The USRDS publishes the statistics for kidney failure for the nation, and they collect all the information from each state. So according to the USRDS, the Native Hawaiian Pacific Islander population, comparing ethnicity to ethnicity, they have the highest rate of kidney failure. And for that reason, it's even more important to me that we educate that population about what they can do to prevent it, or to slow it down, or at least just to even realize that they're at
risk.
So is there any data that could tease out if it's due to lifestyle, diet, genetics? Is there any understanding of the causes for that increased incidence?
When there was a local study done by Marge Mao, Dr. Mao, and a few and other doctors locally, and when they looked at why, it was not anything sexy. It's diabetes, largely diabetes, high blood pressure, and so it again may kind of indicate a genetic sort of predisposition to becoming susceptible to these disease processes, and being higher in the Native Hawaiian Pacific Islander population. And so perhaps for them, even more so, a Western diet, a standard American diet or whatever, is even more toxic given their genetic hand that they're dealt. So back to basics, and Dr. Shintani had created this Y&I diet at one point, and it was really very basic, back to basic, largely plant-based, and less processed foods. I think that is probably good for most of us.
Okay, well that's all the questions we had today. Is there anything else you'd like to add?
Well, I think as far as the Aloha Kidney class series, I just wanted to mention it's not just for those with kidney disease, and that's what I had created it for initially. In fact, I thought it was going to only be for stage 3, 4, and 5, so the later stage. But it turns out that people that are interested in understanding not just if they have kidney disease, but people that maybe have risk factors, or even people who are perfectly healthy that want to understand how to steward their body and their organs and their gifts that they have in body, they seem to come away with as much, if not at least as much sometimes, as those with kidney disease. So I think it helps if you're just interested in understanding, it wouldn't hurt to just come and check it out.
Excellent. Well, thank you so much. This is all great information, and it's nice to have some opportunity to talk about kidneys during a pandemic. So thank you very much.
Thank you too.
Okay.
Okay.